Comprehensive Guide to Golfer's Elbow. The video is created by Dr. Abhinav Gupta and team. In this video we have covered everything about the topic from initiation to the end. Golfer's elbow, also known as medial epicondylitis, is a condition that causes pain and inflammation on the inner side of the elbow. It is typically caused by repetitive activities that involve gripping, wrist flexion, and forearm rotation. While it is commonly associated with golfing, it can also occur in other sports, work-related activities, or even hobbies. The causes of golfer's elbow include overuse, a repetitive strain on the tendons and muscles that attach to the medial epicondyle of the elbow. This can result from activities such as golfing, throwing, lifting weights, painting, or even excessive computer mouse usage. The clinical features of golfer's elbow often include pain and tenderness on the inner side of the elbow, which can sometimes radiate down to the forearm. Other symptoms may include weakness in the wrist and difficulty with gripping or grasping objects. To diagnose golfer's elbow, a healthcare professional will typically perform a physical examination, assess your medical history, and evaluate your symptoms. They may also order imaging tests such as X-rays or an MRI to rule out other conditions and assess the extent of the injury. Special tests for golfer's elbow may include resisted wrist flexion or forearm pronation tests to reproduce pain and assess the strength and function of the affected muscles and tendons. Treatment options for golfer's elbow can vary depending on the severity of the condition. In addition to physiotherapy, other non-physiotherapy treatments may include rest, ice or heat therapy. Non-steroidal anti-inflammatory drugs, NSAIDs, and the use of a brace or splint to provide support and reduce strain on the affected area. In more severe cases, corticosteroid injections or even surgery may be considered. Certainly, physiotherapy plays a crucial role in the management of golfer's elbow. The primary goals of physiotherapy are to reduce pain, promote healing, restore strength and flexibility, and prevent future injury. Here are some key components of physiotherapy management for golfer's elbow. 1. Pain management. Initially may use modalities such as ice or heat therapy, ultrasound, or electrical stimulation to help alleviate pain and reduce inflammation in the affected area. 2. Manual therapy. Manual therapy techniques, such as soft tissue mobilization, massage, or joint mobilization may be employed to improve blood circulation, reduce muscle tension, and promote healing. 3. Stretching and range of motion exercises. Your physiotherapist will guide you through specific stretching exercises to improve flexibility and restore the range of motion in your elbow and forearm. This helps to prevent stiffness and promote healing. 4. Strengthening exercises. Gradually, your physiotherapist will introduce strengthening exercises to target the muscles and tendons around the elbow and forearm. These exercises will help to improve muscle strength and endurance, supporting the healing process and preventing further injury. 5. Eccentric exercises. Eccentric exercises focus on lengthening the muscles while they are under tension. These exercises have been shown to be particularly effective in rehabilitating golfer's elbow. Your physiotherapist will guide you through specific eccentric exercises tailored to your needs. 6. Biomechanical assessment and technique modification. Your physiotherapist will assess your movement patterns and biomechanics to identify any factors that may contribute to your golfer's elbow. They will provide guidance on proper technique and ergonomic adjustments to minimize stress on the affected area and prevent future injury. Seven. Activity modification and return to sport, work. Your physiotherapist will provide guidance on modifying activities that aggravate your symptoms. They will work with you to gradually reintroduce sport or work-related activities, ensuring a safe and gradual return while monitoring your progress. 8. Education and prevention. Your physiotherapist will provide education on proper warm-up and cool-down techniques, ergonomics, and strategies to prevent golfers' elbow in the future. They may also recommend specific exercises or a home exercise program to maintain strength and flexibility. Remember, the specific physiotherapy management for golfer's elbow may vary depending on the severity of your condition and individual needs. It's important to work closely with your physiotherapist to develop a personalized treatment plan that suits you best. Vote of thanks. Thank you for watching our video. We hope this information has been valuable to you. If you have any further questions or concerns, please consult our team for personalized advice.